All right, well, there we are here on AM 1270 and 96.5 FM KXVX, and my name is Bill Kern. You know, I did that on the phone the other day when you called too. My name is Bill, and I said, hey, this is Bill, and you said, this is Paul.
Yeah.
I don't know where the confusion lies.
Hi, Bill. How are you?
How you doing, Paul?
I'm doing great.
So he's Bill, I'm Paul. We're going to get this figured out at some point.
Yeah.
You know, maybe we should switch sides.
Well, yeah. Well,
Sides of the desk. I apologize for that rotten introduction, but here we are on the summer solstice, and arguably the hottest period of days that we've had in a while, and are going to continue to have. It's going to be really hot tomorrow.
yeah, tomorrow's supposed to be the worst day of all.
Yeah, really worried about heat stroke. You know, keeping yourself hydrated.
Heat
I'm sure.
exhaustion.
Heat exhaustion,
Yeah.
that kind of thing. In fact, I heard on the news that heat-related deaths are the highest weather-related deaths are a result of heat, as opposed to hurricanes, tornadoes, any of the other weather-related casualties. Heat is what kills most people.
Wow. Well,
Yeah.
we'll have to all be careful. We know some of the things to do to, if you're not perspiring, you've got to cool yourself down. That's what cools your body off when you're out there. I got in my car when I left work on Monday, and it was 113 in the car. And by the time I got out to Soda Bay Road, it was down to 108, I think. But and that's with our tremendous air conditioning going. So, yes, a lot to be careful. If you are out on the lake or around a swimming pool, remember to put that sunscreen on 30 minutes before you go out instead of when you get outside. And make sure you reapply it every 2 hours if you're in the water, and most of us will be in the water, excuse me, trying to cool off. So we're going to talk about a lot of things. Paul doesn't know this, but after our break, we're going to have a medical trivia quiz.
All right.
And he's cocky about that because he usually does really well. But this one is not a multiple choice answer. He has to come up with the answer. So I'm anticipating, because I didn't do well, and I graduated with a Bachelor of Science degree in chemistry and pharmacy. We'll see what happens when we do that.
Typically, if I just, if I'm paying attention enough, you've gone over most of the subjects before at some point. Yeah. I just have to, turn my brain on to remember.
Well, turn it on, because these are a little more detailed than what we've been in before. Right. So
if I pass, I get the bragging rights still.
Oh yeah,
okay.
yeah, and I'll buy you a refreshment at the concert. So. All right, well, a lot to talk about today. Two new things that I came across, besides reminding you on medical adherence and things, is I just saw an article yesterday on ESP, or one of the health programs, and I think it was CNN, about a new vaccination that prevents heart attacks and could provide an alternative to statins that's being developed by Austrian scientists. And it's shown that the injection can direct the immune system to lower cholesterol. Now, we've never had anything that there was a shot for. And remember, this is a vaccination that's supposed to prevent heart attacks. And if given yearly, and it's annually, every at-risk patient may keep arteries clear and reduce the risk of heart disease. The patients have been enrolled in an early-stage clinical trial to see if the approach so far tested on mice will work in humans. The vaccine, I want you to remember this, is AT04A. That triggers the production of antibodies that target an enzyme that's involved in regulating levels of blood cholesterol. And this enzyme has been shown to impede or slow down the clearance of low-density protein, lipoprotein. That's the bad form, the LDL. That's normally used to be blamed for blocked arteries from the blood. Now, the first thing they did with the mice was fed them an unhealthy Western style, that's our kind of a fatty diet, and their total blood cholesterol lowered by 53% by the vaccine. And this was in the European Heart Journal that was just published last week. Arteriosclerosis, or the hardening of the arteries, that buildup of that hard deposit on the walls of the artery that makes the diameter of the blood vessel smaller, was reduced by 64%. And biological markers of blood vessel inflammation up by 28% compared with the unvaccinated mice. So Dr. Gunther Staffler, who's the officer at the Austrian biotech company which developed the vaccine, indicated people who normally take statins as prescribed in the UK, in Britain, could benefit from a yearly booster jab instead. If those findings translate successfully into humans, this could mean that as these antibodies persist for months after vaccination, we could develop a long-lasting therapy that after the first vaccination just needs an annual booster. That would result in an effective and more convenient treatment for patients, as well as higher compliance, which is what we're trying to get. Doctors have been afraid of and been warned over non-existent side effects of statins that are causing thousands of deaths from heart attacks and strokes as we avoid the cholesterol-lowering drugs. The enzyme that's targeted by those drugs is a PCSK9. Again, I know you won't remember this, but it's made in the liver, and it blocks receptor molecules, or molecules on cells that allow the body to get rid of harmful cholesterol. This vaccine causes the bodies to produce antibodies that lock into and immobilize that enzyme so that they can remain active. And it's like an immunotherapy, but unlike a conventional vaccine that targets foreign invaders such as bacteria and viruses, this marshals the immune system to attack one of the body's own proteins, the bad protein. A phase 1 testing, the activity and safety of the vaccine in 72 healthy patients was launched at the Medical University in Vienna in 2015. The trial is due to end at the end of this year. Before the vaccine can be licensed and rolled out, larger scale trials focus on the effectiveness as well as they will have to be carried out. Now, the downside for somebody like me, who's old, is I'll never see this in my lifetime. But for a lot of you listeners out there that are quite young, or at least 25 younger than I am, if these similar effects were achieved in humans, it would be likely to lead to a reduction in heart attacks. This was a well-conducted study, but very early, and as you know, I like big studies, not small studies. So we're going to have to see if this works out in man. The theory is great. It might have the potential to replace the need to take regular cholesterol-lowering drugs. Now, what are the side effects? We really don't know yet. We find out as drugs are on the market longer that the side effects continue to escalate because we don't know what they are until it's been on the market for a while. It may take many years to be certain about the long-term safety of this vaccine, which, unlike a drug, could produce permanent side effects. This is yet more proof that cholesterol causes heart disease, and lowering cholesterol reduces the risk of heart disease. So it confirms the importance of a healthy lifestyle for everybody, such as statin for people to reduce risks of heart disease. And we're going to talk a little bit later about the use of statins as we get older. One potential safety concern associated with targeting that certain bacteria or that certain enzyme is reducing cholesterol is increasing the risk of diabetes, experts believe, because people eat more carbohydrates and sugars. Having high cholesterol just puts you at a higher risk of potentially life-threatening heart attack or stroke, and finding new ways to manage cholesterol levels is absolutely vital. We've talked 2 or 3 times about the new drug Repatha, which is an injectable that's very, very expensive, and you get in the doctor's office. And it lowers your LDL down in below 50. It's $14,000 at a pop. Is it worth doing that? We don't know, and we don't know what the long-term side effects are. So more research is needed to show that the vaccine is an effective and safe treatment for patients. In the meantime, the best way to reduce your cholesterol is to quit smoking, eat a balanced diet, take any prescribed medicine such as statin as required by seeing your physician, and get it taken care of, because you're going to have to wait a little while before this drug, if this drug gets on the market and if it meets those standards. Now, you're going to hear a lot about a debate whether to use a statin to prevent cardiovascular disease in elderly patients. And we're just hearing at the time new measures for taking certain drugs when you become elderly. And you'll be hearing both sides of the topic on whether or not you should take it. About 35% of patients over 75 without cardiovascular disease take a statin. And there's limited evidence about whether starting a statin to prevent cardiovascular disease is helpful in these older patients. And you'll hear a lot about this. The new analysis of the old All-HAT trial, which suggests that starting a statin in elderly patients may lower cardiovascular risk and possibly increase mortality in patients over 75. So, plus seniors who are maybe more prone to statin drug reactions and muscle pain or weakness may be a bigger concern in older patients. So they suggest that physicians think twice before they start a statin in patients over to 75 at a low risk for cardiovascular disease. That's a heart attack or a stroke. But continue to suggest a statin for higher risk patients, as is a diabetes patient who smokes or has hypertension. You know, as much as we talk about all the time diet and exercise, diet and exercise, diet and exercise, and don't smoke, we still have a lot of people that smoke. And I see a lot of younger people that are starting to smoke that didn't once do that, and they are going to end up having cardiovascular risks also. But for older people who are already on a statin, I think we need to reevaluate whether they still need it. For example, people that are have limited life expectancy without cardiovascular risk factors, probably it's safe to drop it. One more thing about an 80-year-old who has no other disease state and is on a statin as an inflammatory agent or something to keep from getting a kind of a high-fat buildup. And if you're over 75 and you do have cardiovascular disease, it's okay to suggest a moderate intensity statin. You know, we start people at 10 milligram or 20 milligram for atorvastatin. And that limits the side effects until you go up. But if you're doing well on a high-intensity statin, that's 40 or 80 milligram. And as the standard of practice changed a year or two ago, that if you've had a cardiovascular event and you're discharged from the hospital, you're discharged with 80 milligrams of atorvastatin. So the patient most likely to benefit from the treatment with the statin is a 75-year-old with a family history of cardiovascular disease. But I recently turned that magic number, and I don't have a high LDL. I have high triglycerides. I think you know, if you listen to this radio station, I have about everything that you could have. But I continue to exercise, continue to watch my weight, and continue to do medical adherence, which has become a huge attention getter in the health community, about thousands of prescriptions that never get picked up due to forgetfulness, costs, side effects, and so on. Every week we go through our drugs that aren't picked up. We call them return to sender, because when we fill the prescription, we charge your third party for the cost of that prescription. Well, it's illegal for us to keep that prescription in the drawer and not give it to you if you haven't picked it up in a couple of weeks. So every week we go through that drawer and we put back in stock hundreds of drugs that were never picked up. We try to call you first and ask if you have taken the medication, if you forgot that it was due. We have insurance companies calling us, telling us that you've not picked up your medication. Then we have to go in and reverse the billing that we charge you for that medication because you never picked it up. Sometimes that means patients have poor adherence, which can result in the failure of the medication to work, and then you end up going to the hospital. Plus, it can affect our star ratings, which we've talked about, and restocking adds extra work and cost for the pharmacy. We have people that work as a team to decrease those unclaimed prescriptions. We have technicians contact patients before the meds are returned to stock, especially if the prescription is new and for a chronic condition. It's amazing how many prescriptions we return to stock that are antibiotics that people never pick up. And the thing that tragically bothers me is pediatric antibiotics. If you have a child, pediatric, any kind of medicine, if you have a child that was sick enough to go to a physician and the physician call in a prescription for that child and you do not pick that medication up, and many times it's covered by insurance, but for some reason you never pick it up. And we don't understand why, but it's really important. And I know we're trying to synchronize medications if you're taking routine medications all the time so you can pick up multiple meds on the same day. But if you're not picking up your medication, we really want to know why. And your insurance company wants to know why. For example, if you have difficulty remembering to take your meds, start out with the pill boxes that we talk about. And we talked last week or the week before about the blister packs that we do, and we seal the medication in a calendar pack so you can look at that date and see that it was taken by yourself. If costs are an issue, then we'll offer you generic substitutions or therapeutic alternatives and look for duplicates or unneeded meds. I lost 5 prescriptions to a very good customer the first of this week because we lost $126 by dispensing her medication. I had to send her to a competitor, and I said, I can't afford to lose $126 every time I fill your prescription. And we'd been over backwards for the last 2 years trying, and this was a serious medication, but we had to refuse to fill it, and she said, well, I don't want to go multiple places for my prescriptions. And I said, then we'll transfer all your prescriptions to another facility, and we did that, and it hurts me. But that's Big Pharma, CVS, Caremark, the chains trying to get rid of us, so you have to go to them. So if you have costs that are an issue, let us try to substitute. That's what we did in this situation, and we were unable to keep from losing over $100 when we filled it. We need to get these meds in the pharmacy and dispense them within a year of the original fill date. We do the best we can to inform our technicians and our clerks to keep you informed if you don't get with this medication and take it. And it's something that we need to share with you about the intensity and the importance of getting that prescription on a regular basis. Sometimes I have people that just forget, and then they come back to have it refilled and it's still in the drawer and they had not been taking it. Urinary tract infections, by the way, our number is 263-5252, 263-5252. I keep forgetting to remind you if you have any information that you have a question about, and we can answer it, and if not, we can give you the answer next week, or I can call you from our pharmacies. But a lot of people get urinary tract infections, and they take cranberry juice, and cranberry is okay to try for prevention if you don't want to use antibiotics, but the benefit is really quite small. It depends on how intense that infection is, and if it's not too intense, cranberry is okay. A woman wants to try cranberry, explain that either an oral supplement of about 300 milliliters a day of cranberry juice, There isn't strong evidence to recommend a specific product or a specific form, but you stick with most strategies in most women, or if a UTI is persistent, then you want something that would give you a prophylaxis or prevent it. Some people use Bactrim DS or Septra DS, nitrofurantoin or Keflex or Ceflexin. The long-term use of some of these, especially nitrofurantoin, can lead to a peripheral neuropathy and lung and liver toxicity. So we're talking about pain in the extremities, and as well as a problem in your lungs and liver. And that's why we don't see a lot of people that have a prevalence for urinary tract infections to get on an antibiotic for preventive therapy. In addition to that, we build up a resistance to those antibiotics. So we need to be sure that we do everything we can to prevent them if possible, but there's a use with it that isn't consistent anymore about using it from preventing urinary tract infections. This one kind of disturbed me, and I guess I just wasn't aware of this, but there's a new box warning, which is a box warning that we have to warn you about amputation with Invokana. This is a growing list of concerns of these drugs called floxins. Amputation mainly of the toe or midfoot are seen in about 6 in 1,000 patients, compared to about 3 in 1,000 patients per year on other diabetic medications. Now, 6 per 1,000 isn't a lot, but it is a lot when you look at a percentage. And you know, I don't want to concern you a lot about amputations, but the reason that diabetic patients are at risk for amputations is because those blood vessels going down to the extremities become narrow and they become occluded where you can't get blood through there and it becomes gangrenous, or you can't get medicine down there either because of the low circumference or diameter of the blood vessels. So mainly of the toe or midfoot. One theory is that the diuretic effect might reduce the blood flow to the extremities, but diuretics don't seem to increase amputation risk. So even though with Invokana there is a diuretic effect with it, it doesn't make sense that that would be causing any of the problems with it, as well as the diuretic does not do that at the same time. But remember, it isn't just this drug that causes the risk of amputations. It's our lifestyle. It's the fact that you're already occluded in those blood vessels in the extremities. So gangrene is a real reality, and especially if you get an infection in your foot or toes and you don't treat it with an antibiotic, and then you have to treat it with an antibiotic that is a longer period of time than you normally would. A 10-day supply of an antibiotic in somebody who has really severe diabetes is not going to cut it. For now, that warning only applies to the drug Invokana, but any Flozin, any drug that like Farxiga or Jardiance, patients are at a high risk of amputation due to factors such as prior amputation, peripheral vascular disease, neuropathy, or diabetic foot ulcers. So foot care is really important with diabetes. Inspect your feet daily, cut your toenails properly, wear appropriate footwear, contact your prescriber immediately if they develop new foot pain or tenderness, sores, or ulcers. And there's going to be a lot of new trials taken out with these new drugs because of the increase of infections and midfoot or toe amputations because of the medications that you're taking. So it doesn't necessarily have to be the cause of that. The cause could be you, and it's a serious thing to realize. And you don't even have to be a diabetic to have peripheral neuropathy. to have poor circulation in your leg. It can be other reasons, and it's just as important to pay attention to those infections and those possibilities of getting an infection as it would be if you were a diabetic. So, and even if you're not on Invokana or one of the other drugs that they're talking about, you'll see a lot more studies, but you need to be really careful. And remember what I keep telling you, you are your best doctor. You are the person right now. A lot of people don't have primary care physicians. They go to clinics and they see a different doctor all the time. Not saying there's anything wrong with those, but if you don't see, I just had one of my relatives has a cardiovascular risk and has an incidence of accelerated heart rate. And he just went down to a cardiologist, and they asked him how often it happened, and it ended up with an echocardiogram. It was 4 or 5 times a day. And he said, when you go over the bridge and you get to a stoplight, go left to a hospital. Don't go right to this other hospital, because if you do, you'll probably die. Now, I'm not going to tell you where that is, but it has to do with the people that were available in the clinic, not next to a hospital, just in a separate town. And if they went to the other direction, they would go directly to a hospital. So what he was saying is, you have a serious enough condition that you need to go to a place that has the proper care, and a clinic that's not close to a hospital is not going to get you that. So we're going to take a break, and when we come back, we're going to have a little trivia quiz with Paul. Have you been to a pharmacy recently where the employees know your name when you walk in the door and have your prescription refill waiting? If you answer no, then you probably haven't been to one of Northlake Medical Pharmacies. Hi, my name is Bill Kearney, owner of Northlake Medical Pharmacies. For 37 years, my wife Dana, our daughter Brandy, and our employees have been dedicated to giving you the best service we have when you come to get your prescriptions. We are a family-owned pharmacy, and our employees are members of the Northlake Medical Pharmacies family. We know you have a choice when you get your prescriptions filled, and we appreciate you making us your choice. You see, you are part of our family too. We truly care about your health and taking care of you when you aren't feeling well. We deliver your prescriptions free when we know ahead of time and do the best we can to take care of you and your family. Northlake Medical Pharmacies, with 2 locations for you, on Hill Road across from Sutter Lakeside Hospital and outside the Bruno Shop Smart in Lakeport.
This is the Caltrans Road Information Bulletin for Lake and Mendocino County State Highways for the week beginning Friday, June 16th. In Lake County on Route 20 near Lake Street, expect 5-minute delays weekdays. On Route 29 near Bar X and Bottle Rock Road, expect 15-minute delays weekdays. And on Route 175 near Forest Lake Road, expect 15-minute delays. In Mendocino County on Route 1, expect some 5-minute delays at various locations. Also north of Greenwood Road, expect 10-minute delays weekdays. On Route 20 near Road A, expect 5-minute delays weekdays. On Highway 101, expect some overnight delays near the 20 junction. Near Rattlesnake Summit, expect 5-minute delays weekdays. Near the Hermitage Vista Point, expect 10-minute delays weekdays. And near Piercy, expect up to 20-minute delays. On Route 128 west of Yorkville, expect 5-minute delays. On Route 162, expect a few 5-minute delays weekdays from the Rodeo Creek Bridge to Pookaning. On 175 near the 101 junction, expect 5-minute delays weekdays, and east of Buckman Drive, expect 30-minute delays. Finally, on Route 253 near Singley Cattle Pass, expect 15-minute delays weekdays.
Meals on Wheels needs a volunteer driver for the Lakeport and Kelseyville areas. Help make a difference in the lives of our homebound seniors. $20 reimbursement is available. For more details, stop in Lakeport Senior Center's Activity Center at 527 Konocti Avenue in Lakeport, or call 263-4218. That's 263-4218.
Raising your family, tending to your animals, growing your own produce, preparing for the seasons, living the country life. Hi, I'm Jody Henke, host of Living the Country Life. Catch me every Monday through Friday at 9:35 a.m. and 4:35 p.m. for ideas and inspiration for your place in the country. That's Living the Country Life here on AM 1270 and 96.5 FM KXBX.
We bring the community closer together, supporting business in every way. We're helping make your dreams come true, working hard for you. Lake County Chamber of Commerce, join today, it pays to belong.
The Lake County Chamber of Commerce would like to recognize the Member of the Month, Orchid Realty. Sam Orchid, broker-owner, has been in business for over 40 years in Napa and Lake Counties, and his expertise will benefit you in buying your next home. For your next real estate transaction, call 486-1646.
Lake County Chamber of Commerce, join today, it pays to belong. Lake County Chamber of Commerce, we're steady and strong, help us shape the future.
All righty, we're back.
Well, get your brain on.
All right,
It's
let's
time.
do this. Let's see how smart I really am.
How many vertebrae does a human being have?
Oh, good. I don't know why, but the number 26 just popped in my head.
Well, you're not far off. There's 33. There's 7 cervical, 12 thoracic, 5 lumbar, 5 sacral, and 5 caudal.
I see where this is going.
Yeah. How many bones are there in the human wrist?
Oh, let me count them. Does the wrist extend into the hand, or is it just this joint right
Just
here?
this joint.
I'm going to say 8.
You're right.
Yeah!
Holy
Woo!
crap. You got it. That's fantastic.
Ah, 1 for 2.
What's the body's largest organ by weight?
Oh, by weight. It's got to be brain or liver.
The lungs.
Lungs, okay.
They weigh about 42 ounces. The right lung is 2 ounces heavier than the left. The male lungs are heavier than the females.
Only 42 ounces? How many pounds is that? That's
Well, 16.
about 16, yeah, so
2,
just under 3?
3, yeah.
Okay.
I know you won't get this because I've never heard of this muscle. What is the longest muscle in the human body?
The longest muscle in the human body would have to be the muscle that runs down your thigh that I don't know the name of.
Well, it's pretty close. It's the sartorius, which runs from the pelvis across the front of the thigh to the top of the tibia below the knee. So I'm
Below
going
the knee.
I'm going to give you that.
All right.
That's-
Two for 4.
Wow.
I'm still right
Yeah.
there. All right.
How long? Well, I better give you an easy one first. What is your buccal cavity?
My buccal cavity, is that even allowed? We're allowed to say that on air?
Yeah, the answer you are the real answer.
The buccal cavity would be my mouth, but the buccal cavity,
That's it. You just answered it.
the mouth, yes. All right.
Now we're going to slow you down.
All right.
How long is the average adult's spinal cord?
Oh, okay. Let's think here. The spinal cord in an average adult, I'm going to go with 28 inches.
A little high, 17 to 18.
All right. That was a little. That's a long neck. Well,
Yeah.
I'm thinking tall guys. you
Yeah,
know.
yeah, me. Me's
I was
about-
thinking Manute Bull. You know?
Yeah.
Still 3 for 6.
Yeah. How did Louis Pasteur make sure the food he was served at the home of his friends was safe to eat?
I don't even know who Louis Pasteur is. Let's see here.
He was looking for bacteria.
He was looking for bacteria in the food. How did he? He fed it to their dog first.
He took a portable microscope with him.
Oh,
Can you
okay.
imagine inviting him
All
to
right.
dinner?
All right. I should have known. He said bacteria. That should have been the clue.
Yeah. How often does the skin replace itself, the outer layer of the skin?
In days, years, months. Let's see here. The outer layer of the skin, probably as an adult,
Yeah,
I'm going to say every 9 to 12 months.
every 4 weeks.
4 weeks. Wow. You never even notice it.
No,
That's
no,
crazy.
it just flakes off.
Wow. Okay.
Before surgical dressings of gauze and cotton.
What am I? behind now,
Yeah,
right?
you're
I'm
behind
3
one.
for 8. Okay, now I'm starting to show my true colors.
Before surgical dressings or gauze and cotton were introduced, what was commonly used to cover wounds in American hospitals?
Sap.
Sawdust.
Sawdust.
Pretty close, though.
Pretty close, okay.
There are 2 atria in the human body. Where are they?
2 atria in the human body. So if atrial fibrillosis has something to do with the heart, are they in the heart?
That's true.
All right. Boom. 4 for 9. Or
The 2 upper chambers are auricles, and the 2 lower chambers are ventricles. What system? Now you should get this. What system of healing did Canadian-born grocer David Palmer formally introduce in Davenport, Iowa, in 1895?
wait. What
system
of
of
healing?
It has to do with bones.
Casts.
No, casts aren't healing.
No, they're not healing.
I'll give you one.
Healing. What system of healing? Gosh, I have no clue.
Chiropractic.
Chiropractic. Okay.
The Palmer School of Chiropractic
these are hard.
was in Davenport, Iowa.
Oh, okay.
And some of our chiropractors here went to that school.
Wow.
Um,
Never been to Davenport.
You sat on
if
a
I had-
Davenport before, haven't you? Yeah. It's about the same.
If I had, I would have definitely visited that place.
You would have, yeah.
Yeah, right.
This is just for kicks. I didn't know this either because I've probably been labeled this. What does the acronym DSB mean to a hospital worker when somebody comes in?
Can I say it? Dead son of a...
No. Drug-seeking behavior. I thought I'd better interrupt you. All right, we're down to the last 3. How much saliva does the average human produce daily?
Oh, okay.
I think I do more than this.
Court?
You're right again.
Yeah! Woo!
This one you won't get, I'm sure.
Okay.
How many muscles are there in the human ear?
Oh, the human ear.
That didn't.
You know what's funny is I have this book called The Bathroom Reader.
Yeah.
And it's exactly that.
Is it?
And so I do my best reading of that book in the bathroom.
Yeah.
And it gives weird, stats and stuff like that. And it takes like over 100 muscles for the human mouth to speak. Do you know that?
No, but how many
How many
muscles
of
are in the ear? You're trying to distract me here.
25.
6.
6. All right.
All right, your last one.
Okay.
Now, you should know this because I've talked about this
All
before.
right.
What's the average lifespan of a red blood cell in the normal human body?
Of a red blood cell in the human body will expire after 1 day. No.
4 months.
4 months. Okay. I don't remember that, but okay.
That's why you do an HbA1c
Every
because
few months.
It memorizes the sugar content in those red blood cells for 4 months.
Gotcha. What was my total? Did we count them? Or?
Yeah, you were. How many did we have? We had 12.
Yeah.
And you were 8. Not 8 out of 12.
No.
No, 6 out of 12. So you broke even.
I was 500. Wow. My batting average is good.
Well, I'm just amazed. I mean,
half of those are just lucky guesses.
Well, yeah. I mean,
Or some sort of like,
Or the-
suppressed memory that I don't.
or the guy that was asking the questions was easy to give you a yes.
Yeah, there was a couple of those. There definitely was. There were a couple lucky guesses and a couple of those. I
Well, not
agree.
bad. We're going to do this more often. I think
All right.
that it makes us a lot smarter, or we know we're a lot dumber, one of the two. I'm going to one thing, and then I'm going to get back to those smaller things that we're talking about. The Zika virus. You're familiar with that.
Yeah. Oh, yeah.
It's when people get bit by a mosquito and they're infected by the Zika virus, and then they're pregnant, and their child can develop microcephaly, which is a shrinking of the brain, which I don't think you have. But
It hasn't been diagnosed yet, let's just say that.
this is the scary part. Authorities have warned residents to watch out for mosquito bites, clean out pet bowls as these breed in stagnant water. And California officials have warned Long Beach residents that they have detected mosquitoes that carry the Zika virus in the city for the first time. In northern Long Beach, and because we have a lot of people that go to Southern California and come back, they've deployed traps to catch the adult mosquitoes and mosquito eggs in the area, and they released a press release yesterday, or on Monday. This mosquito is a small black and white insect that bites during the daytime, which is good to know at least. But they're vectors, or they're carriers of various tropical diseases, including yellow fever, dengue fever, as well as Zika. And the goal, of course, is to control the mosquito population, so they're doing everything they can to have that not become established or thrive in their communities. There's not yet been any local transmission of Zika in California. The Centers for Disease Control said it had detected the mosquitoes across the southern United States from California to the west coast and up to Connecticut on the east coast. Since the start of this year, 2017, there have been 136 Zika cases in the United States, and all but one found in travelers returning from affected areas. The other case was acquired through sexual transmission. California has the third highest count with 14 infections, behind Florida and New York. New York has the highest, which kind of surprises me because it's mostly tropical areas where they were first found. The symptoms usually develop after a few days and include fever, skin rashes, inflammation of the eye and eyelid. The scientific consensus holds that the infection of a pregnant woman with the Zika can result in microcephaly, resulting in a smaller head and potentially further problems, including a delay in the child's development. So, very serious. The first case of microcephaly in the U.S. occurred in February of 2016. It also has been linked to Guillain-Barré syndrome. A March CDC study found that it was largely responsible for a 20-fold increase in birth defects, including microcephaly. 3 out of 1,000 infants born in 2013 and 14 were found to have those abnormalities. In 2016, nearly 60 out of every 1,000. And Long Beach has advised residents to take steps to avoid mosquito bites, return and report any daytime biting by mosquitoes, and health officials have asked residents to empty any containers filled with water regularly and clean other receptacles such as pet bowls. And it's really easy to, if you're out watering and you're not on a 100% sprinkler system, or even if you have water in little bowls around for cats or dogs or something, and you forget to have them outside, you can get this. Now, I have a waterfall that runs in the back of my residence, and I turn that on every day just to make sure that water doesn't get stagnant in there. And if I forget about it, which is not on an automatic timer because it does use a lot of water and it evaporates, we have set up a potential, and bird baths that we have around that are just water that we put in there for the birds. We have to make sure that that doesn't get diluted or affected, so the mosquitoes can breed in there. Leg cramps. A lot of people get leg cramps, and they'll try anything from drinking pickle juice to putting a bar of soap under their bed, or anything else you might suggest. And leg cramps are different from RLS, which is restless leg syndrome, or statin muscle pain. And there's not much evidence for most leg cramp remedies. Now, as a retailer who sells some of these things, I take a little bit of difference in what is described here, but you start looking for meds linked to leg cramps, such as diuretics, because they get rid of extra potassium. Actually, inhaled rescue inhalers like albuterol, Nifedipine, sometimes switching to another med or lowering the dose might help. The one thing I've always told a member of my family, which I won't mention my wife's name, such as stretching the calf muscles, applying hot or cold packs, and staying adequately hydrated. I think the hydration part is easy to do. The stretching is something when it's the end of the day, you just don't want to do that, but it does help. Clarify the role of the supplements you're taking. Lean towards vitamin B complex as a low-risk option for managing leg cramps. It seems to work for some people. It affects the central nervous system, the vitamin B complex, and if any vitamin is going to give you a spark or increase the stimulation of the central nervous system, it's the B complex vitamins that can do that. We wouldn't recommend off-label use of quinine, which there's only one out now due to the risks of thrombocytopenia and arrhythmias and death because of allergies. It's only modestly effective for leg cramps, and it costs, quinine used to be extremely cheap. It costs about $5 a capsule now. Tonic water doesn't have enough quinine in it to really help. And this one, the homeopathics, Hyland's leg cramps, said aren't proven safe or effective. I sell a lot of Hyland's leg cramp, and they're repeat customers. And when they find it on the shelf, they buy all you have because it works for them. So there isn't a lot you can do except pay attention to the medication you're taking. The reason diuretics cause you to have leg cramps is because they're taking out extra potassium. So if you know that, eat more bananas. You can get an oral potassium that's sold over the counter that's not as strong as what we take. I take a certain diuretic, and I have to take 3 large potassium medications a day just to keep my potassium level high enough that I don't have leg cramps. So anything that you find that's working, you might run it by us to see if it's approved or there's any danger by taking it. But the quinine's the only one that really gave people relief. And for all the times that we sold quinine, we never had a reaction that was reported to us that we could turn into the federal drug agencies for giving a reaction to a bad drug, but obviously people did. So we just want you to be aware that this is a concern that has been well known for a lot of people, and it was a thing that worked, and then they just quit carrying it, so quit manufacturing it. So only to be used for malaria now, and one other thing. Other than that, it's not to be used. So I don't know if you can go down to Mexico and purchase it. The problem is you don't know what you're buying when you go down there. So we have a lot of people that use transdermal patches. Those are patches that you put on the skin to deliver medication. And I think there needs to be some clarification when cutting a patch is okay, because with the cost of this way to deliver medication, it has become quite expensive, and so many people are cutting a patch that has the drug reservoir, such as Androderm or Nicoderm CQ. If you cut that patch, it may lead to dose dumping. Everything dumps all at one point. So you don't want to cut those testosterone patches or those tobacco patches because it could release all of that at one time. How would you know? Well, you would definitely know if you took too much testosterone. It would affect your hormones. The nicotine patches would make you very hyper, especially the higher dose ones. And fentanyl patches, which is the one for pain medication, it can release everything at the same time too. So exact dosing is critical. The fentanyl is the drug that they're now making in an oral form and combining it with hydrocodone, or sometimes with heroin injectable, and it's 50 times as potent as the normal fentanyl, and people are dying. On the other hand, it's okay to cut some patches, such as this Lidoderm that everybody's got a patch for now. It's evenly distributed in the adhesive layer. People need to apply patches to clean, dry, intact skin and rotate sites because the adhesive on those patches causes a skin irritation. So if a patch falls off, it's usually okay to reapply it, but at some manufacturers recommend applying a new patch, such as Detrana, which is a morphine type thing, Exelon or Transderm Scope, which is the one that you take if you're going on a cruise, to avoid getting ocean sickness or motion sickness. Heat, med absorption may be increased if a patch is exposed to heat, but we're mainly talking about indoor heat from electric blankets or heating pads or saunas. If you're having an MRI, you want to remove that patch since patches with metallic backing may overheat during the procedure and cause some burns. I'd never heard of that before. So if you're, especially if you're on a fentanyl patch or one of these hormone patches, I would certainly remove it and then reapply it after you take the MRI. What do you do to if you discontinue them or quit taking them? The FDA recommends flushing some patches such as Duragesic or Detrana. Those are narcotics due to the risk of overdose and health. Other patches can be folded with the sticky sides together and discarded out of the reach of kids and pets. I used to have take care of 4 nursing homes in Lake County, and every 30 days or so we would destroy narcotics. We had fentanyl patches, and we would slit the fentanyl patches open and squeeze the fentanyl out and then flush it down the toilet. We actually had people getting into the dumpsters, sucking the residue out of the fentanyl after it's a gel, so after those had been most of the gel had been removed, people were trying to get it out of the residue out of those patches. So you just never know when it's time for this world has got into any place we can get drugs. Rather than pay for them at the pharmacy because we can't afford them, we'll go to dumpsters or we'll go to whatever. A brief thing, our last one is there's new concerns about when it's appropriate to use short courses of oral corticosteroids in adults. Now we're talking about prednisone, cortisone, Medrol, which is medroxyprednisone. So we know long-term steroid abuse and people that have had to take this forever for osteoporosis, they get weight gain. Their bones get to be very fragile. Just a few days can cause hyperglycemia, which means your blood glucose level can go up considerably in a shorter period of time. The new evidence links steroid use for just 1 week to a slightly higher 3-month risk of fractures and sepsis, which is an infection in the bloodstream. These findings may be due to other factors, and we don't know. That's not why we're making a big deal out of this, but it could be the patient's underlying condition. It's a good time to evaluate whether or not short-term oral steroids and remember we're talking about steroids, not non-steroids. Short course steroids for acute sinusitis or bronchitis or sore throat, probably not the wisest thing to do. In most cases, the steroids reduce the symptoms by 1 day at the most, and really, it's that risk versus benefit thing. The risks may outweigh the benefits in this kind of situation. Now, I'm not asking you to tell your doctor not to prescribe you a medication for that, and even if they do, you may or may not want to take it depending on how serious you're having. But I know recently with this bronchitis that we've had, there's been a few physicians that have prescribed a short dose of therapy. It doesn't take a Medrol dose pack to do those kind of things, and many times that's what's prescribed. It could take 5 or 10 tablets. 5 days of a steroid for asthma or COPD, and for an acute gout flare. Also, you can use a non-steroidal anti-inflammatory for that. the methylprednisolone, which is the Medrol, a short course steroid if you need it, but usually once daily prednisone works just as well and it costs less. So tapering usually isn't needed for short course steroids. If you remember, we used to start out with 8 tablets a day, 7, 6, 5, 4, 3, 2, 1. That's what the Medrol dose pack does, and that's the most common thing prescribed for poison oak and poison ivy once it gets into your bloodstream. So we want you to know that it's probably an overkill in other situations where you just have a sore throat or you have some inflammation. We used to dispense prednisone and cortisone by the hundreds when I first started practicing back in the 60s. And it was 99 cents. We didn't think anything about, we knew how much better people felt. We didn't realize the seriousness of the side effects that you can get from it, and those become a little more than routine when you take it for a long period of time. So it can affect your vision, it can affect your bones, it can affect your diabetes, your blood glucose level. So we just want to remind you that there's always questions you need to ask when getting a prescription like that, and if it's not in your insert, then we need to tell you about it. We'd like to remind you that we are having a gift sale now, 25% to 50% off. Come look at our gifts. We're trying to renew all of our gifts and get it in stock. We have lots of good gifts for the summertime, and we will replace those and get some better gifts in there when we get those weeded out. Remind you that we deliver to Kelseyville and Lakeport, Nice, Lucerne, Upper Lake every day, Monday through Friday, free delivery for your prescriptions. So try us out. We're here to make life easier for you, and if it's 110 degrees and you don't want to drive to get your prescription and you can wait till the next day, give us a call and we'll get it there. So I'd like to remind you we're North Lake Medical Pharmacies with 2 locations for you at 5136 Hill Road East across from Sutter Lakeside Hospital. Call us there at 263-6192. Or outside the Bruno Shop Smart at 347 Lakeport Boulevard. Give us a call there at 263-1328. Thank you, Trivia Man.
Thank you, Bill, and we'll see everybody back here again next Wednesday at 10 a.m. for Health Talk right here on AM 1270 and 96.5 FM KXBX Lakeport.